Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, the traction diverticula, clinical features of traction diverticula. Most of the patients with traction diverticulum are actually asymptomatic. They are asymptomatic, and thus because it is oh sorry Most of the patients with traction diverticula are asymptomatic, and thus, because it is asymptomatic, it is found incidentally during the routine investigations for some other complaint. When the patient comes out for some other complaint, and this diverticula will be found routinely incidentally. But the patient can also have some symptoms. Also, the patient can have dysphagia, chest pain, and regurgitation, but in majority of the patients are asymptomatic, but some patients might also present with dysphagia, chest pain, and regurgitation. Actually, these symptoms like dysphagia, chest pain, and regurgitations indicate that there is some underlying primary motility disorder is responsible for these clinical features of for the mid esophageal or traction diverticulum.
thank you and thank you for watching.